All right, future nerds, let's do this 4-part case study on hypo versus hyperthyroidism. So a 32-year-old female presents to the office complaining of inability to lose weight over the past 5 years. She states she's also having symptoms of daily fatigue and constipation. When reviewing the chart, you notice that she has never had her TSH checked. Match the following symptoms to the associated diagnoses. So it is very common on NCLEX that you will be provided with 2 diseases that are affected by the same organ. So in this situation, we're talking about the thyroid. We have underfunction of the thyroid, which is hypothyroidism, and overfunction of the thyroid, which is hyperthyroidism. And the point of this question is to match the symptoms associated with which disease. So let's jump into it. So cold intolerance. This is a symptom of hypothyroidism. Hypothyroidism is very low and slow. So this person has a very low metabolism and they're going to be very cold all the time. If this patient was hyperthyroidism, then they would be experiencing heat intolerance. Next up, we have diarrhea, which is associated with an overactive bowel. So anything that is overworking it is associated with hyperthyroidism. As stated in the question, this patient has constipation, and this is a symptom of hypothyroidism, a low, slow-moving bowel. Alopecia is thinning and hair loss. This is associated with hypothyroidism. Everything is working very low and slow. Next up, we have depression. This is associated with hypothyroidism. If this patient was hyperthyroidism, they would be experiencing anxiety and nervousness. And lastly, we have diaphoresis. Diaphoresis is the medical term for sweating. This is associated with hyperthyroidism. All right, I hope you learned something new today and you've exposed yourself to types of NCLEX case study questions. Go follow my page. I will be posting part 2 through 4.